UK Healthcare Community Connection is sponsored by UK Healthcare.
Welcome back. We are joined today by Dr. Varun Jain from the UK Healthcare Weight Loss Surgery Center.
Something that I've greatly considered is how I could easily lose weight without all the stress of actually putting in the hard work. But Dr. Jain, I have to imagine,
Sounds like a you problem.
I have to imagine for anyone who's considering consulting with you all, it's not as simple as just show up and there you go, we're on the weight loss journey. There are some things that people need to consider before surgery or medications.
Absolutely. So I would say step one is recognizing that just like diabetes, high blood pressure, heart disease, obesity also is a chronic disease that requires ongoing treatment. Of all the treatment options available, dietary and lifestyle change actually forms the central core. Things like medications, surgery, these can be considered as the most common add-ons with their own efficacy and tolerance profile. Now, there's many factors that need to be considered, things like age, degree of obesity, additional medical problems, insurance coverage. And these are all important while determining what the best approach is for a patient. And I would say nowadays it's more often a combination of approaches. So needless to say, it's a highly tailored approach, and consultation with a specialist is absolutely essential.
In terms of the surgery, how has it changed throughout the years?
I would say the biggest evolution or the biggest change in the evolution of surgery has been process standardization and the increased experience that we have with minimally invasive surgery. So essentially laparoscopic and robotic procedures through small incisions. With this, it has become extremely safe and effective, a lot like a lot of the other more common general surgical procedures that we see, especially when done at centers specializing in this care. And then there are newer procedures that have been approved for either initial procedures or reoperative options for patients that might be struggling after prior operations.
So many people, they think weight loss and they just think about the number on the scale. If they can see it go down, that's a success. But long term, we've talked about this in the past, that's not necessarily the correct mindset to have, right?
Absolutely. Just as with any other treatment, surgery is just another tool in the whole bucket. That being said, time and time again, now multiple studies have shown that with the correct education, counseling, and preparation, surgery still remains the most effective, the most durable, and importantly, the most cost-effective option. Now, what is vital is that continued follow-up, diet compliance, vitamin supplementation, and sometimes fine-tuning is needed. But with this, we see 10, 15, 20 years out, patients might be off their medications, leading a much more active and a higher quality life.
And real quick before we go, you mentioned the physical benefits of weight loss surgery and medication. What about the emotional benefits patients may experience?
That's a majorly overlooked aspect. I would say improved physical activity. Body image, overall confidence. These are just some of the priceless benefits. For people with cured diabetes, it might be lifestyle transformation where they're no longer dealing with daily finger sticks, medications, injections. Now, there may be some people that might be more prone to maladaptive behaviors, maladjustment, but thankfully it's only a minority. But that is exactly why thorough evaluation and patient selection become so important.
For people who want to learn more, where could they best do so?
Our UK weight loss surgery website has a lot of useful information, but what I usually tell people is just talk to your providers. Call our clinic directly. We're more than happy to schedule those consultations with dietitians, medications, surgery. We try and house everything under one roof.
You just saw that information on your screen. Dr. Jain, thanks so much for being here this morning.
Thank you so much for having me.
Nice jacket, too.
I like your outfit.
We'll be right back after the break.
You're watching Fox 56 News, our home, your news.